Answers about surging flu levels here in the Carolinas. South Carolina getting hit harder right now, but both states are seeing some of the highest rates in the nation, according to new CDC data. The CDC says both states have very high flu activity right now. According to North Carolina's most recent weekly report, 18% of all ER visits were for respiratory illness. That's up from 15.6% just the week before. WBTV's Dalford Jones spoke with North Carolina state epidemiologist, and he's getting answers about flu activity in the state and how to keep your family safe. Dalford.
Well, Jamie, since the beginning of the year, the number of people reporting flu-like symptoms has been on the rise. Experts say those numbers are still going up and could peak in the next few weeks. The CDC is tracking patients in emergency departments across the country reporting respiratory illness. In North Carolina, the numbers are in the very high category.
So we're not really seeing any major differences across the state. Everybody's seeing a lot of flu.
We interviewed Dr. Zach Moore, state epidemiologist with the North Carolina Department of Health and Human Services. Dr. Moore told us children 2 and under, people over 65, or with underlying breathing or heart conditions are at higher risk of getting the flu.
Those are folks who are more likely to get sick and really should be seeking treatment for flu, because there are drugs available that can make the difference between just a very unpleasant illness and, something more severe.
Those complications can sometimes lead to death. Last year in North Carolina, there were more than 300 flu-related deaths, including 16 children. Studies show getting the flu vaccine lowers your chances of getting the flu by 50%. This year's vaccine covers 2 influenza A viruses and influenza B.
World Health Organization does flu surveillance all around the world and looks at what viruses are circulating, and then we develop our flu vaccines in the United States to match the ones that are circulating at that time and are most likely to be circulating when flu hits.
And if it hits you, it's vital you speak with your medical professional, especially if you have pre-existing conditions.
It's important to know that antibiotics are not going to help you feel better from the flu. There are antiviral medications, so it's important to talk to your doctor if you think you might have the flu.
Another note from Dr. Moore. Well, if you feel like you're getting sick, yes, you definitely want to speak to your health care provider. But he says, aside from just getting your annual flu vaccine, other things you can do to protect yourself, washing your hands often, stay at home from work or school if you feel sick, and of course, cover your sneezes and your coughs with your inner arm, all ways to protect yourself from the virus. We're live in Charlotte. Dalford Jones, WBTV on your side.
Hopefully we can get through this peak here in the next couple of weeks. Dalford, thank you. Let's give a lot